Hi everyone, Dr. Shauna Kalika with Depth Medicine. Today I want to talk about 3 of the top high-risk asymptomatic conditions that I frequently see pop up in my practice. So by asymptomatic, I mean there are no detectable symptoms by you. You wouldn't know you had these conditions because you cannot feel them. You don't have symptoms that are detectable. By high risk, I mean that these conditions do become life-threatening if they go undiagnosed and untreated. So because the bulk of my practice is treating your personal experience of symptoms so that I'm able to treat them most accurately for you, it becomes really important when there are times to do diagnostic testing because you might fit the criteria for a particular condition and you wouldn't have symptoms to tell you that you had it. Oftentimes the symptoms not arriving until it's either too late or you're just really far progressed in the condition. I'm also wanting to talk about this because even while these tests may be ordered or run by your primary care doctor or conventional doctor, a lot of times what I'm seeing in my practice is that my patients' doctors are not discussing the results with them. So they'll do a blood test, they'll do a DEXA scan, they'll do a pap smear or any other diagnostic test. And I have a burn here. That's what you're seeing. And their doctors will get the results, but they won't discuss them with their patient. And so what that tells me is that the doctor is waiting until the patient is officially out of the reference range and basically in the later stage of progressive disease, and then they start initiating pharmacological treatment. This really behooves the pharmaceutical company, right? This is the only way they make money. But what's really valuable is if you can get your results read to you, discussed with you before they're out of their reference range. So if you're running these tests preventively and or just you're screening for these conditions and you can identify the trend of the number in the direction that it's moving, if it's moving in the wrong direction, you intervene and you initiate treatment. Then you are preventing a whole complicated way of approaching treatment later. And by complicated, I mean if you are bypassing or able to bypass the pharmacological intervention, now you're bypassing the complication of the disease because pharmacology or pharmaceuticals will complicate a natural disease progression. They will add to it. You will prevent side effects that you will then have to treat in addition to the original condition. And then you have the basic length or life of the disease, which becomes harder and more difficult and slower to treat the longer you have it. So the longer the life of the condition or disease, the longer it takes to treat. So there's so much value to catching something before it's technically out of range, so that you can prevent it from becoming more difficult and harder to treat later. So going back to, I'm choosing these top 3 conditions to discuss as being asymptomatic and high risk because they're common in my practice and because they are all treatable and preventable from progressing with a naturopathic doctor like myself or any other integrated practitioner. So in no particular order, the first one would be having high cholesterol and or hypertension, which is high blood pressure. High blood pressure is actually called the silent killer because you can't feel it, and it is so common, and it will kill you. It will result in a myocardial infarction, a heart attack, and or a stroke. So you want to know if you have high blood pressure. The other one would be high cholesterol, leading to the same outcomes. Again, you don't feel the cholesterol in your blood. You wouldn't know that you had it unless you had a blood test. Now, these blood tests are very standard of care for conventional doctors, but again, I am not seeing these doctors discussing the results with their patients when they're creeping up toward being out of range. They wait until they are already out of range, which requires a stronger intervention, which again then complicates the case. And by the time I see you, you've already had years of being on medications which are compounding the original condition, just making it harder and slower to treat. Not impossible, we do it all the time, but for your sake and for wanting to make your life easier, you would want to run a blood test with a practitioner that is willing to discuss your results with you, whether they are out of range or not, so you know where you are and can intervene preventively if necessary. Okay, second one, osteoporosis, osteopenia. You guys have heard me talk about this before. I'm very passionate about bone density and DEXA scans. Osteopenia is a little bit like pre-diabetes, right? It's like the leading up to the official, more threatening diagnosis. So Osteopenia and osteoporosis are regarding having a lower bone density than you need to be strong and healthy. A DEXA scan is the formal diagnostic imaging test. It's a test that you take fully clothed. It's a very low dose of radiation X-ray, and it will target certain joints in your body to determine your bone density. Now, standard of care should be running this test at the age of 65 and above for everyone. However, I'm actually not even seeing this happen. I'm seeing a lot of doctors miss that. But more importantly, I don't think 65 is the appropriate age anymore. It doesn't fit our cultural climate health-wise. So we are seeing way more risk factors for low bone density as early as 50 years and above. So if you fit the criteria for someone who has been on chronic medication use, has a compromised digestive system, so this could be anywhere from just IBS all the way up to IBD, Crohn's or colitis being IBD, but also celiac disease. So anything that compromises your digestive tract is going to compromise your ability to absorb nutrients, which are essential for having good bone density. And then the third one that happens, of course, very frequently as well is menopause. So women are no longer going into menopause in their mid-60s. They're going into it in their 50s. Not having hormones will compromise bone density 100%. So this is something that needs to be addressed earlier than later, because waiting until a patient is far progressed in their disease means that their risk for fracture is so much greater. And having a fracture is time consuming to treat. It's a slow healing process. It's expensive, can be expensive with medications. It's just harder. It's more complicated. So why not intervene sooner, get your DEXA scan earlier, find out where you are, and if you are in the preventive state, initiate treatment then and prevent yourself from becoming osteopenic or osteoporotic. And again, you don't have symptoms for this. You cannot feel when your bone density is low. Okay, third would be HPV. So HPV is a sexually transmitted disease. It's a virus. It's called human papillomavirus. It's very frequent, very common. I know the CDC came out with a new guidelines and criteria for the vaccine. But that aside, HPV in your 20s and 30s, which is when most people contract it, sometimes in your teens, that happens too. It would typically be self-resolving, meaning your immune system is going to take care of it just like any other virus. However, there are times when our immune system is not optimal. We may have concomitant conditions. We might have other viral infections. We might have an autoimmune disease. We might have a compromised digestive tract. It doesn't matter. Any other imbalance in the body is going to make it harder for the immune system to deal with the virus, whether it's HPV or any other virus. And remember, once you have a virus, you always have it. It's just either sleeping or awake. It's either dormant or active. So this test is, to test for HPV is based on a pap smear for women. Men can actually have HPV too, but women get this tested via a pap smear. And I will tell you that it's actually, I have a handful of women who've never had a pap, even though they've been sexually active for many years, just based on the fact that they're afraid to get it, which I completely understand, because there are many practitioners who are not good at giving paps. They are rushed, they are hurried, they don't care how their patient's feeling, they're not gentle. It's a very invasive procedure. It is not something to, it's not something that is sort of, benign or innocuous in terms of your experience. It's a very vulnerable position to be in as a woman, and no one wants to get them. So it's understandable that there are certain women who've been afraid to get them and haven't. However, it is life-threatening, potentially, could be potentially life-threatening. If you've had it for a long period of time, your immune system does not take care of it and put it into dormancy, and it can progress into cervical cancer. So, being an asymptomatic condition, you not feeling the symptoms of having HPV, it makes it that much more important to get your pap smear as a woman and get that test done. Now, because there are a lot of practitioners who are not good at giving paps, it's probably worth talking to your friends, calling around, finding out if there are practitioners who have a good reputation for it. I've known a couple of naturopathic doctors who are very good at giving pap smears. Not all naturopathic doctors do them. So again, calling around, finding out who is a good one to see, so that you have the best experience possible. Okay, so that wraps up the 3 top conditions that I see in my practice that are asymptomatic, are essentially undetectable to you, are all preventable and treatable if they're caught early on. They are still treatable if you catch it later on. But just to say, more motivation, more power to you if you're willing to go in and get these things tested ahead of time. Talk to an integrative practitioner and see what your results are. Get them discussed with you. Make sure that you don't, give your time and your money and your energy to a test only to not get those results discussed with you. I just feel like that's a real disservice. We can consult if you want to talk to me, but otherwise, definitely want to make sure you guys know about these. Thank you so much. Have a great day, and I'll see you next time.